Hello, good morning, everyone. Thank you so much for joining us today. My name is Elise Hummel-Vitale, and I'm the Executive Director of the CACFP Roundtable. Together with Nourish California, I want to welcome you to today's very important town hall, which we are affectionately calling the A in CACFP. I have to tell you all that I have a sleeping baby upstairs and a partner who's at a doctor's appointment. So I'm going to do my best not to run out from the screen in the middle, but if I do, now you know why. So while I say a few welcoming words, please take a moment to say hi in the chat. Tell us where you work and where in California you are joining from. Is the chat available? Yes, the chat is available. Good. So is the chat available? Yes, okay. Now I see it going. Great. So while I say a few welcoming words, I just said that. Take a moment to say hi. It's good to see that the chat is going. That's fabulous. Please continue to use the chat to share your hellos and later on your thoughts and own experiences. However, if you have a question, please submit that via the Q&A feature. Questions in the Q&A box are so much easier for us to see and answer. So for those of you unfamiliar with the CACFP Roundtable, it is our mission to foster a community of leaders who work together to build equitable access to the child and adult care food program and nutritious meals in care settings. We offer education, training, technical assistance. We come together regularly as CACFP peers to work through and support each other in our day-to-day work. And we advocate. For 40 plus years, we've been fighting for the right to a nutritious meal, and we believe that the people behind CACFP are everyday heroes. So today, we are focusing on the lesser known, the lesser discussed, but the crucially important adult component of the food program. This is a conversation that is long overdue, and we are so grateful that you chose to join us and be part of this conversation. It is our intention to listen, learn, and to identify ways that we can all work together to ensure older adults have dignified, compassionate, culturally appropriate, medically appropriate, consistent, and equitable access to the meals they want and need. I'm curious, what did I miss there? How would you describe equitable access to meals for older adults? Please share that in the chat if you will. It is always the right time to be having this discussion, but especially now as we emerge from the pandemic and look ahead at several key advocacy opportunities that create space for positive change, including the federal reauthorization of CACFP, something that hasn't happened in 10 years, the transition of CACFP from the California Department of Education to the California Department of Social Services, and the recent release of California's Master Plan for Aging, which calls out adult care congregate meals as an opportunity for supporting food security and affordable aging. Our format today is more town hall and less webinar. We'll start with two program operators, Marnia and Brandon, sharing their experiences and insights into the adult component of CACFP. And then we will shift to an open discussion to explore the challenges and opportunities in the food program. I want to be really clear, this is a safe space for everyone on the webinar to share and be heard. We are inviting you to participate in really whatever way feels best for you, whether that's through the chat, by raising your hand and verbally sharing your experiences, or simply listening and taking it all in. Before we turn to today's panelists, we want to take a few minutes to introduce some of our federal and state partners that are joining us today. So let's start with Chad Davis Montgomery, Branch Chief at USDA's Food and Nutrition Services Western Division. Go ahead, Chad, sorry.
Good morning, Elise, and thank you for inviting me to join you all for this webinar. I just wanted to say hello to everyone. I am the Branch Chief at USDA Food and Nutrition Service Western Regional Office, and I manage the CACFP team. And so me and a couple of my staff members are listening in to today's town hall. This is, as Elise was saying, a very important topic and one that we want to listen and learn as well. I'll just say a quick word that this is personally important to me. I've spent 15 years in the federal government, and the first 8 years was with AmeriCorps and Senior Corps, and I managed the portfolio of Senior Corps programs in Northern California for many, many years. This is a population that I'm really interested in making sure that we are supporting equitably. So I'm very interested in today's conversation and look forward to hearing and learning from you all. So thanks so much, Elise, for the opportunity.
Thank you, Chad. Okay, so next we have Chantel Bush, Staff Services Manager 2 in the CalWorks branch in the Family Engagement and Empowerment Division at the California Department of Social Services. Go ahead, Chantel.
Thank you, Elise. Good afternoon, everyone, or near afternoon. It's a pleasure to join you all today. I am sitting in today for my leadership in the California Department of Social Services from the Family Engagement and Empowerment Division. Under the leadership of our Deputy Director, Jennifer Hernandez. As Elise pointed out, the CDE CACFP workload will be transitioning to the Department of Social Services effective July 1st. As you can imagine, we are very busy with finalizing all of our transition activities, and that is one of the reasons why my leadership has appointed me today to go ahead and provide you with a quick update, considering they have some overlapping meetings. So what I wanted to do, just in respect of the timeline of today's agenda, just wanted to provide some really quick updates regarding some status of things going on in the Department of Social Services. So right now we are in the process of finalizing the fourth quarterly report, which is due to the legislature by July 1st. As a commitment of our continuous transparency throughout this transition process, we will be releasing that fourth quarterly report early, sometime this month, near the third week of June. Additionally, it's a requirement of the Childhood Development Act of 2020 that we submit quarterly reports to the legislature through 2024, which describes how our department is making progress on the transition and how we're furthering the intent of the transition. Additionally, we are in the process of finalizing a communications plan for the child care and development workforce and our CACFP sponsors, because we want to effectively deliver information out to the field regarding resources and contact information to aid in the continuity of daily operations and services as we do this transition. This will be sent out using the CDE and CDSS Child Care and Development and CACFP listservs. I also want to bring attention that we'll be launching a CACFP focused website in the very near future, and we will be working with the CACFP Roundtable folks to share links upon the release, and we will provide a centralized email inbox for inquiries moving forward. We really want to engage with you all about what the needs are, what the resources and information that will be needed and relevant to your continued daily operations. I did want to provide another reminder about the wealth of resources and information that is available on our CDSS Child Care Transitions webpage. Just to name a few, we still have up on our website posted the transition plan, a key milestones and timelines document, all of the prior quarterly reports, and a frequently asked questions document that's getting regularly updated with additions and additional information. We also have information about forthcoming stakeholder engagement meetings. And lastly, I also want to just remind that on this same Child Care Transitions webpage, there is a link that we are keeping up to engage with your sharing of your feedback and input via SurveyMonkey. Or if you have a question or inquiry about the transition, you can submit your question to our email inbox at cctransition@dss.ca.gov. And all of the information on this webpage is accessible and translated in Spanish. That concludes my updates for today. Thank you so much for this opportunity.
Thank you so much, Chantel. And I noticed that we have Jennifer Hernandez with us as well, Deputy Director of the Family Engagement and Empowerment Division at CDSS. Jennifer, if you wanted to say hello very quickly, please do.
Just hello, and I look forward to the conversation. Thanks.
Wonderful. Thank you, Chantel and Jennifer. Lastly, we have Samantha Bernard, Health Program Specialist 2 at the Nutrition and Wellness Bureau in the California Department of Aging. Go ahead, Samantha.
Hello, everyone. I'm happy to be here. As stated, I am the Health Program Specialist 2 for the Nutrition and Wellness Bureau at the California Department of Aging. Those of you that may not be familiar with our department, we focus on providing services to older adults in California, various services, including nutrition programs. You may be familiar with home delivered meals or congregate meals. Those are our predominant nutrition programs, but we also provide other services that support nutrition programs, supportive services, legal, all those things. So our focus is to provide services to older adults so they can stay in their homes and or stay in their communities and just remain active and healthy for as long as possible. So I look forward to the conversation, and I'm happy to be here. Thank you.
Thank you so much, Samantha, and all of our partners. I'm going to now pass it off to my co-host and the mastermind behind this town hall, Cameron Mims-Jones with Nourish California. Take it away, Cameron.
Thank you, Elise. I don't know about mastermind, but it was a willing partner, and I do appreciate the opportunity to work with you. As Elise said, my name is Cameron Mims-Jones, and I'm a policy advocate with Nourish California. My organization works to shape the programs and policies that should connect, but sometimes stand between people and the food that they need to thrive. We work with an urgent focus on improving access to food for Californians who face the greatest needs and starkest inequalities. Our team is a statewide organization, and we lead statewide advocacy efforts to end poverty, disrupt poverty, and ensure that all Californians are well nourished. I'm not going to take up too much of your time because I do remain extremely curious, as I first was when I heard about this program and the program, the component and who it serves. I'm privileged policy advocate because at my core, I'm a social worker and also a political scientist. This kind of provides me with this weird, powerful balance of like nerdy curiosity. And it makes me, I'm sparked by data, but compelled by the lived experiences to support and fight for the solutions that we find in need and representation of certain communities. I came upon this great description of the population that you serve, and it sort of has sparked. This is what sparked the beginning and I guess as Elise spoke about the mastermind behind wanting to have this conversation. In reference to adult day health centers in California and the program that CACFP and the people that CACFP serves, I read that the ADHC is considered the participant is considered an ethnically diverse population, a medically complex, and disproportionately socially disadvantaged. I think as I described our mission for the Nourish California, that absolutely is who we're trying to serve and who we're trying to understand the needs for this population. And so that's why now. I guess that leads us to the why now. As Elise said, there's a lot of advocacy opportunities. There's the CNR, as she spoke of, that sort of brings the CACFP and the adult day health and the population, has this opportunity to bring that population into the light. And so we wanted to convene this space to have begin that dialogue. The state, as you know, the Master Plan on Aging, there's certain initiatives that really call out nutrition, and they speak to the experience of the unprecedented death rates to the Black and Brown, Latinx, Asian Pacific Islanders in the communities that were negatively impacted disproportionately by this pandemic. The Master Plan on Aging also speaks to data plan initiatives, wanting to understand and be data-driven about the population. The initiatives in the Master Plan talk about identifying opportunities to expand federal reach of programs that are in our state. Things like the medically tailored meals, our adult and the meals found within the CACFP program. I think that the current investment that the state budget has been put forth by the governor makes clear that there is a desire in our state to invest in infrastructure to support the nutrition need for older adults. And I think that this is a great space to hear how you feel those funds should be allocated and where they can be of best service. I think that also this program touches upon caregiving support. It's both intergenerational, meaning it meets the needs of our youngest, and it's also meeting the needs of some of our oldest members of our community. And so in that vein, what we've seen as a result of the pandemic, that caregiving support and the quality of caregiving support and how we invest in caregiving support is always important, but in emergency situations and going forward, we know that that has to become a primary focus. My work is interested and intersected with older adults who need and have the greatest needs, who are currently may or may not be have experience with certain benefit programs, but are still finding malnutrition and food insecurity as a part of their everyday experience. I'm really glad that Chad brought that personal component to his work and his passion, because I am absolutely there with him. I have the opportunity to be in this space and be part of change for this space, along with a colleague who raised me. My mother is both involved in older adult world, and she is, of course, an older adult herself. And so I strive to understand the population, to understand the needs, and to make the services that are currently available stretch all to meet the larger demands, as much of the large demands as possible in the state of California, because of as a result of my personal connection as well. So with that, I'm really excited about having this opportunity to speak with our panelists. I'm going to ask a couple of questions, several questions, and hopefully it'll spark some conversation with the panelists. From the panelists will spark conversation from our attendees. You will be able to ask some questions, answer some questions as well, along in the chat, and also, the questions please in the Q&A section, as Elise said. And so with that, I'm going to ask our first panelist, Brandon, the first question, if he's ready.
I'm ready. Hi, everybody.
Awesome, Brandon. Thank you so much for being here. Brandon, I want you to have the opportunity to explain and talk about who you are. And so I don't want to give too much of an introduction. I think that I will say Brandon is an advocate at heart. Every time I spoke to him, he shares something and that provokes change for me as a policy person in the advocate policy space. So I do appreciate that we have the opportunity to have him share about his experience with the CACFP program. So with that, you have some time to speak, and then I'll get to ask you some questions as well later.
Yeah, not a problem. I'll make it short and sweet. My name is Brandon Gary. I'm the executive director of Building Better Communities Foundation. We are a nonprofit sponsor, unaffiliated sponsor of the CACFP in California. We've been doing so since roughly 2012, probably about 100 or so centers. I think we're kind of a mid-sized sponsorship. Some people say large, but I think we're about mid-sized. We have sponsored on a direct service basis, and what I mean by direct service basis is the actual meal service provider for adult daycare programs in Southern California and most recently in Bakersfield. We've got some limited experience with adult daycares. I've gone through several audits as a sponsor of adult daycare centers, so I've seen some hiccups that the adult daycare world provides to a sponsor, and just trying to fit it into the nuances of the CACFP. But ultimately, that's who we are. That's what we've done. I'm an attorney by trade, and I kind of jumped into this program as a way to give back. And so I've been enthralled and fulfilled by it. And I support the program and want to see it really blossom and flourish.
Awesome, Brandon. Thank you so much. We're going to have Elise, did you want to reintroduce the format again? I'm sorry. I'm trying to.
Yeah, that's okay. So next we'll hear from Marnia. Marnia, we'd love for you to share a little bit about your experience with the adult care program, and then we'll move into the Q&A format. So Marnia, your turn. Marnia, you are on mute. Saying of the year.
Okay, yes. Hello, everyone. I'm glad to be here today to share my experience with the Adult Daycare Health Program. I work for St. Isidro Health organization here in San Diego, California, and it's a federal qualified healthcare center. With our federal qualified healthcare center, we also operate PACE programs, which is the program of all-inclusive care for the elderly. So the PACE program is a coordinated health and social services program for the frail and elderly, allowing participants to live at home and remain in the community. PACE provides special programs and services to aid our frail elderly in our community to age well in place. So we have care teams that work together to prevent or quickly address problems that the elderly population face daily. This results in better health and quality of life for the elderly in our communities. So as a profession, I'm a registered dietitian, and my role at PACE is I'm the RD, registered dietitian supervisor. So I supervise our 3 sites, nutritional services program. I supervise the RD and the kitchen staff that administers the CACFP program. So we are a sponsor site also. And right now we have 3 sites that we are, we are known as the fastest growing PACE program in the state of California. And we're looking to open up another PACE site this year and another one in 2022. So we are in the business of making sure that we provide the best quality care for our elderly in our community. And again, I'm glad to be here today. Thank you.
Thank you both, Brendan and Marnia. So the way that we were hoping to structure this is Cameron and I drafted up a handful of questions that are kind of broad in scope, and we hope will help us all explore the opportunities and the challenges, barriers, you know, all of the things about the adult component. And we will pose these questions to Brendan and Marnia, and we hope that Brendan and Marnia, you will help us get started by answering them. But we also are posing all of these questions to the participants in the webinar on the town hall today. So again, feel free to be an observer and listen, or maybe you have some thoughts on the questions that we're posing. You can put them in the chat, or we invite you to raise your hand and we will call on you, and you can, that will unmute you, and you can share verbally about your experiences, thoughts, concerns, etc. Okay, so Cameron, I will pass it to you to pose the first question.
All right, unmute. All right, so let's start with you, Marnia. Why does your organization choose to serve older adults through CACFP?
Well, like I said, we are a PACE program. So the program is Program of All-Inclusive Care for the Elderly. So we serve the elderly. The CACFP program was brought about when the organization was made aware of the program, and they decided to have this program to help them with the reimbursement of the meals that is required anyway. So for the Program for All-Inclusive Care for the Elderly, we're required to serve breakfast, lunch, and snack anyway. So we just added the CACFP program to add as a reimbursement, a small reimbursement for the services that we already provide.
Awesome, Brandon. I guess, I mean, you spoke to some of that, obviously why, but do you want any further thoughts that you want to have and why?
Yeah, well, my organization started off as an at-risk sponsor, and so that's really where our direct service component came from. And so just looking for other ways to leverage the program. And really, we found the adult daycare component to be widely underutilized in terms of CACFP. So nobody was really targeting them. And if you're talking about dollar for dollar, bang for buck, the adult daycare centers stand to benefit much greater than your average childcare center, because most everybody that's there qualifies for free meals. And so, at that free category and that free rate, you're getting the the greatest reimbursement for the population that you're serving. So that was just the reason why we decided to go there. So it would have the greatest impact, and it's just being underutilized.
Brandon, I think that's a really great thing that I think maybe we should speak to. Like, why do you think that it was before? Why do you think that you were able to just sort of jump in why was it being underutilized? Or did you getting indications as to what was going on and how you were able to take advantage of that?
Yeah, well, one, I don't think it's widely advertised. Two, I think that adult daycare centers have alternate sources of funding that they're mainly concerned with, that childcare centers don't. And so childcare centers are, kind of picking and choosing, like they're trying to find it however they can. And so most childcare centers know that CACFP exists, whereas adult daycare centers probably do not, or they probably don't want to be bothered with it if they do. So I think that was sort of the programmatic issue that I found. And then there's just not a lot of them, so some of them are here today, gone tomorrow. Some of them are in community centers, and some of them that are bigger, you can't really get to the person that is the final say. And then there's also the liability of it, and people are afraid of it. So you kind of have to dispel the myths that are around it, make them feel good about it. And then if they are still on the phone with you, then get them to the part where, it's a reimbursement program. So.
Cameron, I'm going to ask Sam if there's anyone in the audience who either has their hand raised or maybe posed a question that you want to share out loud, Sam.
We do have a hand raised. I'm going to go ahead and allow the person to talk.
Thanks, Sam.
Go ahead.
Yes, thank you, ladies and gentlemen. My name is Laura Okunobi. We provide services to adults with developmental disability in a day program setting. I have my hand raised because I'm listening to all those great opportunities that people are providing. But here we are, we have a challenge. All adult day programs receive their funding from the federal waiver, which is called the HCBS, Home Community-Based Services, in addition to the CMS, which is a medical waiver. So in the past 3 years, we are all mandated more or less to provide person-centered services, which is a great thing, in integrated community settings. They are discouraging site-based services. Site-based service no longer has value. So my question would be, how are we going to able to balance the requirement of CACFP that requires congregated setting? In other words, you're eating in a site-based, in a room, or whatever, to align with the expectation that you need to be in the community. Because when we are in the community, we will be using, or we hope to use CACFP at the park. It will still be congregated, but it will be at the park, maybe 4 people sitting together, another 8 people sitting together. But we will not have the 100 and something people that we currently serve, all sitting in classrooms to eat together. But that would be a challenge. And we don't want to lose this opportunity for nutritious food. Can we transition to a grab and go? Because I'm not even sure what that will be, what that would look like. So I need guidance from those of you that are experts from CACFP. How do we marry these two expectations?
Thank you so much for your comment, Laura. And it sparked some other hands raised. I wanted to look to panelists, see if you wanted to respond or comment on that as well, or maybe we continue to take a few hands from the audience.
I'll comment on that. I have implemented the bulk meals option, which is a combination of 2 USDA waivers, one congregate meals and the other being meal times. And I found that to be wildly successful, both on the at-risk side and with the adult daycare center side. I hope that USDA continues to extend that. It's a pandemic era, measure, but I think it's been found, being successful across the country. So Obviously, there's going to be hiccups along the way, and we have to figure out, from an auditing standpoint, how to protect the integrity of the program. But by and large, I think it's really had a great impact. So I think what her question lends to is that congregate setting. If USDA continues to utilize that for maybe at risk or for adult daycare, especially adults, because they are a sensitive population, I think you could get around that congregate setting requirement.
And I would like to add,
go ahead, Maria.
During the pandemic, we also decided to do the grab and go, and actually we did delivery. And it would be nice if they could look at different ways to service our community besides the congregate meal site. One thing that I noticed is that with our center has stopped the grab and go starting May 1st. We stopped because I did have the waivers also to from the USDA for the congregate meal site and the meal patterns also. We stopped because one thing, the pandemic is less now, is going down, but one of the major reasons were that it was hard to, in our population with the elderly, grab and go. A lot of family members are not there to come pick up grab and go. A lot of older people do not have transportation to pick up grab and go. So we just thought we started a delivery service. And at the time, at the beginning of the pandemic, our transportation team didn't have anything much to do with the vans. But once we started back up and started taking participants back to their doctor's appointments and specialty appointments, it became a hardship for us to continue the grab and go program because it turned into more of a delivery program. So I made sure that and then keeping all the paperwork to maintain the integrity, to say, yes, this elderly person has given us permission to deliver to their home because they're unable to come and do the grab and go option. They have no cars, they have no family members that are willing to help them to get the food to them, to the homes. So we had to, like I said, we stopped the program in the beginning of May. It was a big hardship for us, but we made it work during the pandemic. And my staff, we actually used our own cars to deliver meals to our participants because we care that much. So it would be nice if the powers that be could look at a different way how to serve our seniors.
I'll just share that, I think there's something really oddly beautiful coming out of the pandemic where we can take lessons learned about how we had to, on a dime, shift the way we do things and find the good pieces that we want to carry forward. And I think this is a really excellent conversation. Cameron, did you want to add something, or should we see if there's more folks with their hands raised?
There is more folks with their hands raised, and we should see that. But I do want to say that absolutely is true. And one thing that I learned about this program, being from the adult component to the child component, that every person who I've come in contact with who provides this meal has the same passion that Marnia just said about if it has to happen, if someone needs to eat, they're going to eat, and we're going to make sure that happens. And I hear that in every single CAC operator, from the children that are in their homes to obviously to someone who is talking about having people drive to have their food delivered. And that is another reason why I'm so passionate about this program, is that is the culture that is within people who decide to do CACFP. And yes, we have two hands raised. So Sam, take it away.
Let's give it over to Lydia. Go ahead, Lydia.
Hi, it's actually Tina Sadarangani. I'm Lydia's colleague. I got signed in as her, but I wanted to thank you guys so much for doing this presentation. It's so important, and I am a researcher at NYU who's been researching this very topic of the child and adult care food program as it pertains to adult day centers. And my questions are really around what I've heard based on the qualitative research that I've done, and sort of what your advice and comments are in terms of how these programs can be strengthened. So what I commonly hear when I interview adult day centers about this is that the paperwork and the administrative burden of the child and adult care food program is very high for a relatively low reimbursement that doesn't reflect, the changes in the cost of staffing, et cetera. So that's, increasingly we're seeing that some centers are deterred from participating based on this. The other problem I commonly hear about, because I mostly research centers that service ethnically diverse populations and older adults from ethnically diverse communities, is that the restrictive nature of CACFP makes it challenging to serve meals to diverse communities. You have a dairy requirement in centers predominantly serving Asian Americans who may have a high incidence of lactose intolerance. Or, for example, you may service a disproportionately high number of persons with dementia who truly would benefit from a more liberalized diet. But yet there are such parameters around low fat, low salt, low sugar, et cetera. So how do you get engaged centers and more help them to sort of reduce some of this restriction to better serve their population? And sorry, my last follow-up is that, the parameters of CACFP, to my understanding, differ from that of other programs like the OAA meal programs that service older adults. So how do we reconcile all of this to better make it meet the needs of the population it's intended to serve? Thank you.
Oh, Tina, thank you. I would like to put out there that I did quote Tina when I first started. Tina is the architect of the diverse, complex. So I will say that Tina is the inspiration. I appreciate you weighing in and being here, Tina, and posing that fabulous, amazing conversation. And I'm glad Lydia had you, or you're here.
I stole her link. Yes, thank you.
Thank you very much. Brandon, Marnia, would you like to speak to some of those things?
Or anyone in the audience?
Or anyone in the audience?
Maybe we put a pin in that and go to the next raised hand.
We've got Laura again. Here, I'm going to unmute you.
Yes. Yeah. The last speaker, I think, probably better articulated my question, which is because the lady that talked about driving and going to deliver them, we all have access to that waiver, but that's a time-limited waiver. As people are returning back into the community and into the program, who should be the authority that we talk to in order to extend something like that? And the restrictions posted by CACFP, which may be, I'm sure, it needs to be revisited. The operating operators program, whatever that word is, that French word, again, maybe the attorney knows that. For an adult day program is different from a senior program, is different from a child care. The children don't go anywhere, so they eat their breakfast, lunch, and snack in the same place. The group homes don't go anywhere, they eat their lunch, breakfast, the same place. But for us, we're no longer allowed to be in a building. They want us to be in community setting. So does that mean now that we have to let go of the lunches and the snacks that people have come to appreciate and enjoy? How do we mitigate this? I need answer. I need guidance. Maybe if you don't have answer, if somebody can direct me to which of the offices of CACFP can answer this question, because I've been asking the specialist, she doesn't know. So, but we're not going to be able to continue CACFP with the current expectation. And that would be a shame.
That would be a shame, Laura. Brandon, did you want to?
Yeah, I think that, so, and mind you, like this is, I'm borrowing from Jerry, whom, Elise and I work with closely. So CACFP is a small component of just a larger governmental response to nutrition, right? And so I think when we look at some of the old and arcane ways that it sort of functions and some of the regulations that are still there, it's just due to the fact that sometimes it gets overlooked in favor of looking at SNAP or other larger programs that really command the public's focus and therefore like the representatives' focus. But I mean, just recently, we just received documentation that says that for summer food, you no longer have to look at the ethnic breakdown of children. And, it's no longer right to kind of, assume what they are based upon what they look like. Like that's just an indicator of some arcane view that now has been culturally modernized within the government. And so, it's maybe taking this focus on CACFP and say, hey, listen, we need to revisit some of the ways that this program operates. I know we've looked at all these other programs, but this deserves some attention as well, particularly because as I think Tina had identified, it's I'm not going to call it paltry, but it's the outpacing of the costs of the program, of operating the program, and the reimbursement regime that kind of funds an operator's running of the program that makes an operator not want to participate in the program. And from a CACFP stance, it's designed as a supplementary program, but that supplementary nature of this program really only applies to certain settings where they don't have, where they've got general fund monies that can be passed around, to offset the costs of CACFP. Not every program is capitalized that way, particularly after school programs are not capitalized that way. And I'm sure that adult daycare programs that are receiving government funds, those funds are specifically earmarked for certain things, and it can't be, commingled and crossed over. So I think just requiring or asking, USDA and through that right, some of our elected officials to revisit looking at how this program operates and modernizing it both culturally and operationally, that would maybe make it more attractive to newer participants. Anyway, that's it.
I think that's really good. I think in summary, I would just say that this is a federal requirement. And so the opportunity is right now with the reauthorization to contact your Congress member and tell them, Laura, all these things that you're sharing with us and why it's so important that we work to strengthen the program.
We do have one more hand raised. Corinne Jones. Yes.
Good morning. Corinne Jones here. I'm Program Director for the Multipurpose Senior Services Program, which serves Lake County and Mendocino County in Northern California. We serve older, frail adults. And one of the things I want to jump in here and say is that the greatest issue comes back full circle to be money reimbursement. And it makes all the difference because that's been borne out by the Great Plates program that was available in areas. Rural areas have extreme issues because of limited quantity of providers, the rural nature of where everybody's all spread out, et cetera. Getting a qualified Meals on Wheels program is difficult, but it all traces back, in my opinion, to the amount of reimbursement. Great Plates was something like what, $30 a meal, 3 meals a day. If a provider of meals could get $90 a day per client, you'd have people jumping over each other in order to be providers and to cook and serve and what have you. And so I'm very active legislatively as far as advocacy for the Multipurpose Senior Services Program. But one of the other things that we're speaking loudly and more loudly about has to do with senior nutrition. The money needs to come, it needs to be available, and it needs to be made there has to be an ease of use and ease of access, because my rural people up here in Ukiah have no opportunity to go down the block to a nice restaurant or a restaurant that's serving, good fresh vegetables and what have you. It doesn't exist. You have to get in your car and drive. So I'm if you have a car, obviously, and if you're older, it's just a whole different thing. And I just want to encourage anyone and everyone that's listening to also remember to take into consideration the setting. Rural areas have other problems in addition to the same ones that you have in urban areas, but it's extreme because of the location and the lack of opportunities for servers. Thank you.
Thank you, Corinne Jones.
You're welcome.
AKA Mom. Thank you. I appreciate that. The next question I will pose that I think is, since we've had this robust conversation, I do think that it would be great to get some of like a perspective of a client perspective. So we have a question. Are there any client stories you want to highlight? Really like sort of bring out the who you serve, Marnia and Brandon both, to really be bringing back this program back to the actual participants.
the daycare centers that we've served on a direct service basis provide services to the aged elderly and also the disabled. So they had a dual population. Is that kind of what you're asking?
Well, I mean, I guess I was more specifically, I know that like when we say a complex medical, like sort of like those are descriptive words, but I don't think that they really get to necessarily who this program is actually involved with. Or so I was that was what the question was. And sort of if you have any reflections on that, either one of you.
And what it makes me think of is, Marnia, we were having a discussion about the types of foods being served and how your adults really want coffee every morning. And I was like, yes, they're adults. Come on. Of course they want coffee every morning.
Yeah.
So those kinds of stories about how this program is, from your perspective, experienced by the participants. And where there's room for growth.
In that conversation about texture. Remember, like the texture of like needing texture things. So that sort of experiences, I think.
And of course, audience, raise your hand if you'd like to share as well.
I would just, with the previous conversation with our population at our center, I think with the challenge with CACFP of being a registered dietitian is serving therapeutic diets for the participants for disease management. In my center, I have a lot of participants who are diabetics or they're on dialysis and they may need a renal diet. So what the dietitians, what we do is that, for example, a lot of doctors at the center really do not like the CACFP meal pattern. I get a lot of issues with the doctors. Is this serving, is this good for a diabetic or this good for a renal? So what we do is kind of, with our care plan, we have our dietitians, we take our CACFP meal pattern. And for example, if I had a participant the other day who had a blood sugar that was over 500 before we fed her lunch. So one of the things the dietitians had to do was we altered the meal pattern for that day for her without giving her we have to serve a whole grain rich. I mean, she didn't need the bread for the day and she probably didn't need the fruit. So just being able for the elderly population to have a change in the meal patterns for them to help them manage their diseases, the disease management therapeutic diet. So that can be a challenge with the CACFP program meal pattern for adults. When you talk about milk, I waste milk every day. We throw away milk every week because they do not want the milk. But I offer it. It's offer versus serve. So I offer it. They decline, and I continue to purchase because that's a requirement for CACFP. But they don't want milk. I have a lot of participants who have allergies to milk or lactose intolerant when you get older. So it is some challenges serving the population with the CACFP program. We try to work around it. And if I have a surveyor or auditor come in, it's kind of show the paperwork that, this participants may not receive the milk because we have a medical statement, the participant's care plan that says they're lactose intolerant or have an allergy to milk or things like that, or they're diabetic and I did not serve that whole grain rich because I'm trying to reduce the carbs in their meal pattern for the day. So things like that. And the texture modification, she talked about texture modification. We do puree the meals, which is smooth like baby food, puree food items for the participants who have problems chewing and swallowing or have throat swallowing issues, and we have a speech therapist on site, or we chop up the meals for them who have chewing and swallowing. So just having a challenge with making sure that we provide the appropriate diet for disease management and texture management for our participants is very important.
Thank you, Marnia, because I think that really is, there's a question, we have a question about wanting you all to speak to the nutritional needs of older adults. Because as Tina shared about maybe it might not meeting the needs specifically for the population because of the specific needs of health needs for the population. And so I'm glad that you spoke to that. And I would wonder if maybe anybody else in the audience has any thoughts about that, like the literal nutritional needs about dealing with disease management and things like that. I've read some reports that discuss about meal patterns being really about the current meal patterns about not getting the diseases or disease prevention, and not these meal patterns speaking to the disease prevention, not speaking to the needs of people who actually already have the disease. So once you already have the chronic illness, how is the CACFP meeting those nutritional needs? And so I'm glad you shared that. And if anybody else has any sort of reflection on that, we want to hear more about that.
I think ultimately, you can kind of achieve anything that you want to, but the CACFP just for especially for adults, it just doesn't reimburse enough. It comes down to money. It really just comes down to money. If you wanted to address or find a meal that's going to meet the nutritional needs of an adult that has these sorts of issues or diabetic issues, like, those meals typically cost more than $7 a day, across, maximum that you could probably get on CACFP is $7 a day, $8 a day, whereas I believe, I forget her name, Madam something or other. I saw it at the bottom.
Laura.
Yeah, Laura. Yeah, there we go. The Great Plates program was paying, upwards of, 30. So you could do a whole heck of a lot more with that amount of money to address somebody's, unique nutritional needs versus, $7 or $8 a day. And when I have to make 3 meals and a snack for this person. So I think it's just money.
Thank you, Brendan.
I think we have someone who's raised their hand.
We do. I believe it's Tina again.
Yeah.
Thank you guys again. Yeah, the other thing is I agree money is the big thing that talks, but I also feel that in terms of speaking all the work I've done with adult day centers, they're so well intentioned and they're so driven by a commitment to deliver person-centered care. And when you have strict regulations, like it's actually inhibiting their ability to do what they perceive as their job to deliver. Like nutrition is so individualized and personalized, as I alluded to earlier with persons with dementia, perhaps at certain stages, they should be having a liberalized diet, not one that's restricted on salt, sugar, and fat. And so they're going to have more behavioral symptoms because they come home hungry than they otherwise would from the center. So I think it's not just the money, it's the lack of flex fundamentally, like the lack of flexibility. Even if you doubled what you were giving them, if you don't give them the flexibility to do what they see as best for the participant that they're caring for, it runs counter to the organizational culture at these centers, which is driven by a commitment to deliver patient-centered care.
Yeah.
Thank you so much, Tina. I have, I think we're coming towards the end of the hour and I want to pose one more broad general question, but we have a couple of, I believe, yes or no questions I just wanted to flag for the group. One is, for sites doing delivery meals, did anyone have to create a delivery permission form? If so, could that be shared? And so if there's anyone out there who created a delivery permission form, the roundtable is happy to be the vehicle with which to share that out, or we can connect via the chat directly. So that is one question that came up. And then another question was for Marnia. Why did you opt for CACFP versus Title III for reimbursement for centers? And then we'll go to our last question.
Yeah, I saw that question in the chat and I was going to answer it, but it's not that I opt for it. I inherited it when I had the job. So it's not that I opt for it when I was at this program and got the job. It was landed on my lap. So I had to find out everything about CACFP to get it going. And the organization wants to continue to be a part of the CACFP program. So with the 3 and all the centers that are opening, I'm in the process of getting them all, approved to be CACFP program sites. So that was that was part of my job description. So, but I have talked about it in the past, looking at now as I move forward in the program. I have been looking at trying to do more research on other grant funding programs, other reimbursement programs, or for the elderly as it relates to nutrition and the needs of the elderly, because I have been feeling that CACFP is not meeting all the needs. So that's something that I'm researching. And then once I research and I can present it to my organization as something that they can opt to participate in rather than the CACFP. They're so used to participating in the CACFP that I don't even think that they are aware of other programs, the Older American Act, or any of those things. So I'm researching that now to try to bring that to their attention to see what will be the best option for our seniors.
Great. That's great. Thank you. Okay, so last question. Get your fairy wand out. What do ADHCs need to make CACFP more operable and better for clients? You know, give us your wish list, or you wave your magic wand. We hope that maybe Brandon, you can start, and we hope folks in the audience also chime in, whether it's in chat or raising your hand.
I would say the requirement of licensure needs to be revisited. If they didn't have to be in a licensed care setting for adults, you would have a proliferation of community-based settings that could cater to those same people that maybe aren't as mobile as others. Two would be revisiting the reimbursement structure for these specific types of agencies. And I had a third one, but I lost it. But yeah, I think those two. Oh, the third one was the documentation of disability. As a sponsor, that's always really thrown my reviewers for a loop, because in California, it's a HIPAA violation for me to go in and look at somebody's medical records to document what their disability is to avail them as a program participant in CACFP. But as a sponsor, I'm supposed to have that information ready for a review. So I think that also needs to be revisited as well, maybe some sort of a self-attestation form or something else that qualifies that participant. But I don't want to jeopardize myself by, a HIPAA violation by operating the program in an adult daycare facility. So those are my three.
And I would add, I think of all the CACFP roundtables and meetings that we have, I think we talked about decreasing paperwork in the program. I think that's everyone's ask. Number two, I would say get rid of the meal benefit form. It's been a challenge for me to obtain the meal benefit form, which is a requirement for CACFP when it comes to the elderly. A lot of them cannot sign. A lot of them don't understand the paperwork. They can't read. Their family members are not there. In my facility, I usually have the social worker help them with the form to understand the form. But a lot of them really, it's hard to get the meal benefit forms from them, but I kind of have to hunt them down to make sure I meet that requirement. Also, as I talked about before, flexibility in the meal pattern for the elderly and meeting their disease management and providing therapeutic diets for the disease management, and also educational resources for the elderly. I cannot really advertise for the CACF program in an adult daycare setting because all the marketing is for children. So I don't put up any of the marketing resources that CACFP provide because it's inappropriate for the elderly population.
Thank you so much, Maria. Do we have anyone with the hands raised?
Hi, you.
We almost made it the whole town hall without the kids.
Go ahead, Laura.
Yeah, one other redundant process that hopefully they can change is on the eligibility roster, at least for us in adult day program. Those who decline the meal, CACFP expect us to still put their names there. And when you put their names there, they want you to classify them under base rate. It doesn't make sense. Somebody does not want a meal. Why are you classifying them that they have to pay full price? They don't want the meal. So keeping that in the data, and I'm not sure what that data does for them. Those who want to eat, we have them listed. So that is another thing that they need to revisit to make it easier, because it's kind of confusing.
Thank you so much, Laura.
No.
Anyone else with their hand raised? Cameron, do you have any closing thoughts before I say goodbye?
I want to say thank you, Brandon and Marnia, for indulging me when I first started to understand this program. Both of you, I want you to know, infused passion and desire in me as a result of the conversations that I had with you about your experience with the program. And I really appreciate all of you. And we're going to, I think that there's a lot of action items that we can take from this. But I think that the transition, as Elise said, is a great opportunity for some of these things that we can take into place right now, I think, too. And I really appreciate everyone for coming to this awesome town hall. And I also want to say thank you, Elise, for being a partner in this with me. Like, your leadership, your help, and your support, and this is why this is possible. And I know that like the roundtable is an amazing space because of the leadership that you're going to, the leadership you bring. So
Thank you, Cameron. Thank you too. I really can't say thank you enough for your passion, excitement, and stirring and excitement in me as well. I'd like to say one more thank you to our partners and our presenters today. Thank you, Brandon and Marnia, and all of our partners at the state and at USDA, and to everyone in attendance for participating. You really participated in this communal conversation about the adult component of CACFP, and we are very, very grateful. I'm looking forward to continuing to support your ever important work and your ongoing work, and also working with the broader CACFP community and all of our wonderful allies to continue to grow equitable access to healthy meals for older adults, and also to really build a CACFP in California that is truly a model for the rest of the nation. So you see our contact information up on the screen. Please feel free to reach out to myself or Cameron or both of us to share more or to raise anything that may have come up for you after participating in this town hall. I know I always think of the thing I want to say, a couple hours after everything closes. So please feel free to stay in touch. With that, I will say, stay healthy, everyone, and thank you so much for joining us. This concludes today's town hall. Goodbye.
Thank you.
thank you.